Hi, welcome to Your Health Matters. I'm Scott Kern. Today, we're going to talk about how to lose weight in 90 days and the KRMC Del Webb Wellness Center's outpatient diabetes program. And to help us learn about all this stuff is Jennifer Hardy, our registered dietitian. She's got a lot of great information, so stick around and come back after these messages so you can learn how to lose weight in 90 days. Hi, and welcome back to Your Health Matters. I'm Scott Kern. Today, our guest is Jennifer Hardy, a registered dietitian from the Del Webb Wellness Center. Welcome, Jennifer.
Thank you.
Hey, so you got this great program that the Wellness Center is starting. It's the Weight Loss in 90 Days Challenge?
Correct.
So what's going on with that? Talk to me about it.
So we changed our program. It used to just be the OptiFast program, and now it's going to be 90 Days to Change featuring OptiFast. So what's going to be happening is we're hoping in 12 weeks to help you develop new habits to help towards a healthy weight. And that can be, this program involves weekly meetings. You're going to meet with myself and you're going to meet with a personal fitness instructor who's going to go over different aspects. Because we know weight loss isn't just about food.
Absolutely, it's a lifestyle.
Exactly. So it's behavior change and exercise. So hopefully we're both speaking to two different aspects that can definitely help patients work towards changing lifestyle habits.
Cool. Okay, so let's do a little role playing then. Let's pretend I want to join the program.
Yes.
So what's the first step?
The first step is come fill out some paperwork.
At the Wellness Center?
Correct.
Okay.
And we are going to have you fill out some pre-screening questionnaires to make sure you're kind of in the right health that we want.
Okay.
If you're not, you may have to have a medical screen done by your doctor prior to coming.
Okay.
After you do that, we have you go and meet with one of our staff. And so our staff then does something called a polar body age, where they do your percentages and things like that to find out what percentage body fat you have, and percent of lean body mass. And we also kind of put you through an exercise routine to kind of give you something to base off of. Then after that, you come and you meet again with me and we sit and talk about the diet plan and kind of what diet range I want you to stick with.
Oh, okay. So, let's talk about diet plans real quick because, I know as you get older, your metabolism slows down, so it gets harder to lose weight. You have to stay more active.
You do. Well, at every age, you have to stay.
You have to stay active at any age regardless. You're absolutely correct. So talk to me about some diet plans that you have found effective. You can just be kind of general on it. I know a different diet works for different people.
Correct.
So
the best diet is one you'll follow.
That's true. That's very true.
But an easy diet plan you're wanting. So something called the plate method is a very easy diet. It's an 8-inch plate. Half that plate is non-starchy vegetables. A fourth of that plate is your carbohydrate, and the other fourth is your protein.
Okay, so when you say non-starchy vegetables, that's anything but potatoes, right?
Corn.
And
peas.
Peas are made of starch?
Yes.
There goes my whole diet.
I know.
Oh, man.
It's kind of a blow when I tell people that.
Oh, well, yeah, I can imagine.
Yeah.
So in the carbohydrates, you want a simple carbohydrate. I can say the word, I promise. You want a simple carbohydrate, so I'm assuming that's like a brown rice?
A complex carbohydrate.
Oh, complex carbohydrate.
Yeah, so one that's higher in fiber.
Okay.
So, right, like brown rice.
Quinoa, maybe?
Yeah, some quinoa would be great. Quinoa's got a little more protein in it too, so that's fantastic. Try barley. You can do whole wheat pasta. You can do other grains that you maybe aren't as familiar with, but try them, like wild rice even too. Those can be really good sources of fiber.
So you can kind of play with it as you go. You can find out which vegetables you like and which ones go nicely with barley. I've never actually heard of anyone put barley in a meal.
Yeah.
It's usually in a liquid form is when I have it, so it's beer.
Oh, okay. That makes sense.
But this is a great healthy way to have it though too. It's what's your favorite diet plan? I mean, what works for you? Do you have like a staple go-to?
It's usually the plate method. Yeah. I try to get as much vegetables as I can on that plate because I'm going to fill up on them, and they're low calorie. So that's a great way to do it. And they're high in fiber.
Okay. So you said you meet with another physical professional, I guess, like a coach, would you say, or?
Well, a fitness instructor is going to come, because we have weekly meetings, so you're going to come in, you're going to get weighed, so we're making sure you're making your progress, and then we're going to talk about different aspects, and the fitness instructor is going to have certain goals for you for that week, for what we want for your physical activity, and I'm going to have certain goals, what I want you to do with diet or behavior modifications I want you to work on.
Okay.
And so it's kind of, hopefully, a triple aspect of working towards making changes.
So it's I don't want to say holistic, but it's a whole world approach.
Yes, and you can incorporate OptiFast food into that. That is an added cost to the program, but we only are going to use about 2 products a day, 1 to 2 products, just so that we don't have people not able to transition off product, or they don't just become dependent on product.
Okay, so let's talk about OptiFast then. What exactly is OptiFast?
So OptiFast is a meal replacement. We have different kinds of product. We've got soups, we've got drinks, and we've got bars. And so they're high calorie, high protein products that kind of help to supplement a meal.
Okay, so and you're trying to implement 1 to 2 of those products a day into
if you
the
so
program.
want to.
If you want to, it's strictly optional.
Yes, it's kind of like an a la carte program. You can add more personal training in, you can add more sessions with me if you so choose. Yes, those are add-ons, but you don't have to.
Okay. So you mentioned the personal training. So obviously that's an additional cost to the program, but we do have personal trainers here in the Wellness Center.
Correct.
That can work with you.
Oh yeah.
To get you back on track and get into the program with the 90-day weight loss. The personal trainers, it's a great piece to have with us, because that's extra motivation, and they do tailor the workouts to you and your abilities. That way you're not running 5 miles right off the couch. They help you get to that level. And just like you do with the weight loss program, so when you're coaching somebody, you can sit down and you have like a plate. We should have brought a plate with us today so you could show me the 8-inch plate, because I don't think I've ever actually seen one that small.
Well, think this is 8.5 inches, right? The width of this. So it's a little bit more.
Okay.
It's not that small, because we eat with our eyes. And if you have a really big plate, you want to fill up that plate. And
Absolutely.
if you don't fill it up, you feel a little deprived. And
So
we never really get over that.
It's almost subliminal then.
Yes.
So it's very sneaky.
Right.
I like that.
You're tricking yourself.
You're tricking yourself. So let's talk about the polar body assessment then. What exactly is the polar body assessment?
They're measuring different aspects of your body to kind of see your body fat percentage and your lean body percentage. And they're going over questionnaires with your nutrition intake and your health as it is already, to kind of see where your body is. Your typical age, how old are you?
I'm 33.
So if you did your polar body age, if you're in good health, you may actually be, like, let's say at a 26. If you're not in such great shape, we may be more at like a 46.
That's why I'm afraid to take this, because I don't want the polar body thing to tell me I'm pushing 50.
Oh, well, I don't think it would.
Yeah. But so that's cool. So what happens, and just to recap, it's for me and it's for our viewers too. If I wanted to join the Weight Loss in 90 Days program, I come into the Wellness Center. Do I ask to talk to you, or can I talk to one of the front desk representatives?
You can ask to speak with us about the weight loss program, or you can call our phone number, and our phone number is 928-263-3838, and somebody can tell you more information about the program, or they can schedule you to sign up.
Now, is that your direct line, or is that?
That is the office coordinator.
The office coordinators? Okay. So you can call them. So I come into the Wellness Center, I talk to the office coordinator, she sets me up with
an appointment.
So I can talk to you about my diet program.
Or you can just sign up on the program.
Okay.
We'll have you sign up.
And then it's a weekly meeting.
Yes.
What night are the meetings held?
We're going to do it on Tuesday mornings.
Tuesday mornings. Okay. What time?
At 8 a.m.
8 a.m. Tuesday morning. That's very early for a program like this. So you're getting all the motivated people to come in. That's really cool.
I'm hoping.
And is it here in the Wellness Center?
It's going to be here in the Wellness Center, or in the medical professional building. It will be in one of those rooms.
Okay, so they can call for more information, and that number is 263-3838.
Correct.
Okay, so you wear a lot of hats here in the Wellness Center.
Correct.
A lot of hats. So you're also our outpatient diabetes coordinator.
Correct.
So we have a lot to talk about with that later on too. So how did you get into this position of that you're currently in, as far as running the weight loss center programs and also the diabetes program? Like, what's your background?
So I'm a registered dietitian. I've been a registered dietitian since 2006. I had to do a 10-month internship in Boston, and I did that at Beth Israel Deaconess Medical Center, which is a really long name for a hospital, but it was good.
It's a pretty significant hospital, though, for your program, isn't it?
It was great. It was a Harvard affiliate, so we got to see some really good talks from some really great doctors. And after I did my internship, I came back to Arizona. I was born and raised in Arizona, and I chose to come back, and I worked at Good Samaritan And after that, I transitioned to Las Vegas, and I worked at Sunrise, and now I'm here.
Oh, cool. And you've been here at the Wellness Center for how long?
Almost 2 years.
Has it been almost 2 years? That's fantastic. So you've taken on quite a bit in the past 2 years and really shaped the program and to get going in the direction that you want, especially this OptiFast and weight loss program. What caused you to, I guess, what was the need in the community for this? What got you thinking that this would be the best program for?
Well, I wanted to make it a little more cost effective for folks, just to see if we could get some more people in, because I know a lot of people are interested in weight loss, but it's a challenge at times. It's also a challenge to get people motivated and what we can find. So I really wanted to see something where there's two people that are really going to help jazz you up, move you, want to hold you accountable, and I will do that as well. Tiffany Johnson, she's the personal trainer that works with us.
Tiffany will definitely hold you accountable.
She'll hold you accountable.
She can be very intimidating when she wants to be.
Exactly. So that's a great thing, and people need that.
Oh, cool. So I'm going to recap one more time, just because I know it's good for me. If I hear it 3 times, I'll remember it. So you come into the Wellness Center, you ask to talk to the office coordinator, you can sign up for the OptiFast program.
Correct.
When you sign up for the OptiFast program, they get an initial consultation with you and Tiffany, the personal trainer.
Not with Tiffany.
Not with Tiffany. Okay.
Then I sign you up for a Polar Body Age.
Polar Body
Age. And then
Age.
you're going to meet with one of our fitness personal fit.
One of the fitness
It's
desk attendants.
instructors, and they will go through all the Polar Body Age with you and the kind of the machines and make you familiar. And then after that, you'll start meeting with us weekly.
Okay, what's the price for this?
$250.
$250. How long is the program?
12 weeks we meet, and then after those 12 weeks, you meet with me once monthly for 3 months. So it's a total of 6 months where you're kind of coming in and seeing me.
But it's a 6-month program for $250, or that's not a bad program for it. Really.
And you can choose to just do a one-time fee of $100, and then you're paying $37.50 for 4 weeks.
Okay, that's not bad at all. So there are payment plan options there. Okay, so they can do that. They can come to the Wellness Center and sign up. They can call you at 263-3838 for more information.
Correct.
Okay. So we're going to wrap up this conversation about how to lose weight in 90 days. I think we've learned quite a bit about that, but we're going to go to commercial break, and when we come back, we're going to talk about the outpatient diabetes program, because I know that's been here at the Wellness Center for a long time, and you've really done great things and made great strides with that over the past few years too. So I want to hear that process next. I think it's going to be pretty cool.
Okay.
All right, so stick around. We'll be right back after these messages.
And so that can be a very dangerous situation. If you go too low, you could pass out, you can lose brain function, right?
Hi, welcome back to Your Health Matters. I'm Scott Kern. Today my guest is Jennifer Hardy, a registered dietitian at the Del Webb Wellness Center. So Jennifer, we have talked about your weight loss in 90 days program.
Correct.
It's a fantastic program. It's $250 for 6 months?
Yes.
Okay, so that's a great price. At a great rate, that's half the year, and that's a lot more streamlined, because you've been able to reduce some of the other options and add some additional options that are more cost effective for the I don't want to say patients, but for the members, the participants. That's a good way to put it. So that's really cool. So like I said at the start of the show, you wear a lot of different hats for the Wellness Center. Your main hat is you're the outpatient diabetes program coordinator.
Correct.
So let's talk about that.
Okay.
Well, let's talk about diabetes first, because I know what diabetes is, but I don't know what diabetes is, you know? So talk to me about how does one determine if they have diabetes or not, or how does one get diabetes?
So that's the hard part. How does someone get diabetes? So you have genetic factors that can definitely put you more at risk for having diabetes. If you have a family history of diabetes, you are much more at risk for developing diabetes. So it's really important if you know, okay, my mom, my dad, my grandma, my grandpa, somebody had diabetes, or even my siblings, you're getting a yearly test. Your doctor's aware of that. The family history definitely puts you more at risk.
So be accurate and be honest in your family histories at your physician's office. Okay.
And so hopefully it's an open discussion with family members. Some people don't know their past medical history or even their family history. So I shouldn't say they know their past medical history, but they don't know the family history. And it's really important if you can have that conversation with family members to have it so that you know what to get checked for, to kind of say to your doctor, hey, this kind of goes on in my family. Can we please make sure we keep an eye on it?
Makes sense.
Your doctor only knows as much as you tell them, or your provider. So the other things that play a role are sedentary lifestyle and being overweight can definitely put you higher at risk for type 2 diabetes. So there are different types of diabetes. There's type 1, and there's type 2, and there's gestational.
So, okay, so type 1, what is type 1 diabetes?
So type 1 is an autoimmune disorder where your body actually attacks, or your immune system, I should say, attacks the insulin-producing cells of your pancreas, and you no longer produce insulin.
Okay.
And so insulin is always necessary with type 1 diabetes.
So with type 2 diabetes, then, you mentioned that you can't live a sedentary lifestyle, and sedentary means you can't be essentially lazy.
You can, it just does not help you with your blood sugar per se. And it can put you more at risk for developing type 2 diabetes in the future. Whereas type 2 diabetes, those patients are still producing insulin on some level. And so that's where we get into this pre-diabetes, then we develop diabetes. Where pre-diabetes is where you're still within a range that we don't classify you as diabetes, but we know that you're more at risk for developing diabetes.
Okay. Now, what about gestational diabetes?
Gestational diabetes is diabetes of pregnancy.
Oh.
And if you per se, you wouldn't, but if a female does have gestational diabetes with one of her pregnancies, she is much more at risk for developing type 2 diabetes in the future. So it's really important, if anyone's ever diagnosed with gestational diabetes, that they try to get on a healthy eating plan, exercise plan after delivering their child.
Absolutely. So gestational diabetes, I guess, is only temporary for the time?
Most of the time. There are a few instances where it does develop into type 2 diabetes after birth.
So what would you say are the best treatments for diabetes?
Best treatment. It matters what stage of the disease state you're in. With type 1, you will always need insulin.
Okay.
With a type 2, depending if we've got you in the early stages, you may be controlled through diet and exercise at first. And then depending on how we progress or things like that, you may need medication. You may need oral medication, or you may need injectable medication.
So once you have diabetes, do you have diabetes for life, or can it go away because of your bettered lifestyle?
Right.
I guess?
That's a big hot topic that some people say, well, there's a new cure for diabetes, weight loss surgery. But a lot of people that are in the health community say you never are clear
fully
of
goes
diabetes,
away.
right? You may be diet and exercise controlled, but you will always have diabetes.
So it can go dormant, I guess is the best way to put it. Like,
Yeah, kind of, we could say that.
you can say that. So it's not. So it's kind of there, but it's not really there because you're controlling it through diet and exercise.
Correct.
So if you quit the diet and exercise, you have to go back on the insulin,
Most
whether it
likely.
be oral or the injection.
Correct. Well, oral, you don't take oral insulin, but
Oh, sorry.
no, that's okay. And a lot of people ask that. Well, why can't I just take insulin in a pill? Because unfortunately, once you put it in the digestive tract, it's not effective.
Oh.
You have to inject insulin.
Okay. So, like last time, in the first segment, we talked about how someone can sign up for the Lose Your Weight in 90 Days program. How does someone get into your outpatient diabetes program? And what does that program do for them?
Okay, so you need a referral from your physician because we are credentialed through the American Diabetes Association, and through that credentialing, they require we have a referral.
Okay.
So once we get a referral and we make sure that you're okay with your insurance, you come in and you meet with me. We have a one-on-one assessment, and depending on where you're at or how you're doing, we may or may not put you in diabetes classes. And those classes are something called a DSMT course, which stands for a Diabetes Self-Management Training course. And that is a series of 5 classes. They're taught by different healthcare professionals, myself being one, an exercise physiologist, a nurse, and a pharmacist also teach in those classes. So it's a good, well-rounded program.
And how often are those classes?
Those classes are every Friday morning from 9 to 11 for 5 weeks.
You really love having morning classes here, don't you?
I do find that people like to do morning classes.
That makes sense. If it gets the people in the door, it gets them educated, it keeps them on the right track and keeps them honest. That's the best way to do it. And
Patient population doesn't necessarily like to drive at night.
oh, that's true
And I
too.
can understand that too.
Do you have that brings up a great question. Do you have an age demographic of your average patient, or?
Most of my average patients are older than 40. That doesn't mean I haven't had younger patients, but the majority of them are older.
Okay. So you mentioned that the American Diabetic Association has made some guidelines for diabetes. What are those?
So for diabetes, what they're saying for their guidelines for blood sugar, their goals, they've actually increased their goals. So they're fasting blood sugar. So fasting is a fast of 8 hours. So that morning blood sugar, they're wanting you between 80 and 130. Then 1 to 2 hours after a meal, they're wanting you to be less than 180. So it used to be that they wanted you between 70 and 130. And I think they were finding that people were having too many issues with low blood sugar when we kept you in that tight of control. And so that can be a very dangerous situation. If
Makes
you go
sense.
too low, you could pass out, you can lose brain function, right? You go down, you lose oxygen. Not a good thing.
It's true. So, okay. Wow, that's kind of scary to think about when you think about it like that.
Right.
So, when they're setting these programs, are there rules to, like, I know fasting, you can't eat 8 hours prior, just water. But the regular food, I guess what I'm trying to say is with the diet, they have to check it has to be less than 182 hours after. Is that while they're on a diet, or is that just the regular,
when they're on their medication, when they're eating what they normally eat, that's our goal. If you are already in that control, or if I can make you in tighter control, I always want to have people in as tight a blood sugar control as is healthy for them and is not going to put them at further risk, because we can have high expectations for individuals, but if they live alone, if they're older, we can put them at risk for falling and breaking like a hip, and we've done you no favor.
Yeah, you don't want to do that.
Yeah, no, not at all.
So what got you interested in becoming a diabetes expert, I guess?
Diabetes expert. So I think once you're a dietitian, there's different aspects of things you like, and I like educating patients, and this was an area where I could sit down and talk with an individual one-on-one. Because I saw in the hospital, I'd give them a tidbit of information, and they'd go home, and there was so much going on, they didn't really get to absorb
They didn't pay attention
anything.
to it.
Yeah, and so hopefully this was a chance to give them more information, have them absorb it a little bit better, and be someone that could be a support system to an individual.
Okay, that's cool. So you got your start in the hospital setting, obviously. So you were on the floors working with the patients, helping them set up the diets, and then did you have to do like an internship for diabetes, or how did you get credentialed in it? You just...
I'm still working on my credentials. I will be taking a test here soon to become a certified diabetes educator, and that's an exam you have to sit for, and it's a national board certification. So.
Oh, that's cool.
Yeah.
So that's pretty impressive. So you can really make the program go gangbusters at that point, right?
Well,
hopefully, ideally.
We'll see. Hopefully, I just think it's a good credentialing tool to have. That it makes people feel like they're going to see somebody that knows what they're talking about.
Well, obviously they already do, but it puts the paper on the wall
Right.
and make them feel at ease at that initial consultation and as they're going. So, you said you've been in Kingman for 2 years. Can you estimate or guesstimate like a diabetes population in town? Is it
about
bad in Kingman?
8%. It's pretty normal for the Arizona population. We're about 8 to 9% with diabetes that know they have diabetes. This is the problem. We have a huge population in the U.S. that doesn't know, because you can live with type 2 diabetes for up to 10 years without realizing you have it.
Jeez.
Because your body is an amazing thing, and it will adapt. It will adapt to a higher blood sugar, and it will get used to this higher blood sugar. And you really, with type 2, you don't necessarily develop those emergency warnings that you would with type 1. Because type 1, they have no insulin. So all of a sudden, they start losing weight. They start going to the bathroom all the time. They start doing all these things that would take a type 2 maybe up to 10 years to develop.
All right, so let's talk about symptoms then. What are some of the symptoms of?
So some of the symptoms of, let's say, uncontrolled diabetes are going to be extreme thirst. You need to urinate often because you're so thirsty, you're trying to get this extra sugar out of the system. Blurry vision, slow healing wounds, hunger, dry skin, which can be hard because we live in...
The dry climate here
Exactly.
does not make it easy on that.
And drowsiness, you just feel very lethargic. And depression can
Really?
definitely act like high blood sugar.
So if you have any of those symptoms, you should go see your medical provider.
Right, we're hoping you're seeing somebody.
Yeah, if you haven't, go see your medical provider because
Correct.
that's very important. We want to get you diagnosed as soon as possible to get you back on the track to wellness.
Yeah, and that's the problem is if you have type 2 diabetes, you may not have these symptoms for a very long time.
Well, that's all good information. So let's kind of recap everything here right now. We've got the Lose Weight in 90 Days program. You can come into the Wellness Center. You can sign up for that, $250 for 6 months. That gets you consultations with you, weekly classes every Tuesday at 8 a.m. In the Medical Professional Center here. It gets you the option to buy into the OptiFast program, which are supplemental meals or what have you that people can add to their diet. They get the diet plans, weekly weigh-ins. They get to meet with our fitness professionals about the polar body age, and they have the option to work with one of our personal trainers to help get them on a workout program.
Right, they'll hear them speak weekly.
Okay, so that's a lot, but that's a great price for everything you're getting with the weight loss in 90 days. And then for the diabetes program, the outpatient program, they need to get a referral from their physician, correct?
Correct.
Okay, so they get their physician referral, then they can come back, see you and they can start their program to get that under control. And those classes are every Friday from 9 to 11.
Correct. And I
Perfect.
need to have a referral for them to go in those classes. So I apologize if anyone shows up and wants to go through the diabetes program.
First things first, see your physician.
Yes, or your provider.
Okay, Jennifer. I want to say thank you for coming today. It's been a great show. I think we've learned a tremendous amount. And in fact, I know we learned a tremendous amount. So thank you again. Hope you come back on the show whenever you want. Maybe we'll play some games next time.
Okay.
It's been a great day here on Your Health Matters. Thanks for watching. Tune in next time with another great guest.